you, Dr. Neha and Sahani sir. Good evening, good afternoon, and good morning. This is the 1360th day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to this session, and today our guest is Dr. GURUKIRAN. Let us begin the session with 1 minute silent prayer. All of you know that International Forum for Promoting Homeopathy was formed during the time of pandemic, and we were able to connect with the doctors from different parts of the world, and there are people and doctors from 65 countries presented various papers on this forum, and all the presentations were excellent, and we have published some of them in the YouTube, and you can watch the previous presentation in our YouTube session. So let us introduce today's guest. As you all know that Dr. N. GURUKIRAN has completed his BHMS and SCPH, and he has graduated his BHMS from Government Homeopathic Medical College Hospital, Bangalore, affiliated to Rajiv Gandhi University of Health Science. He is a classical homeopathy practitioner in the district of Chamaranangud in the state of Karnataka, and he has 15 years of clinical experience. He is an independent fellow in SCPH. He has completed the postgraduate fellowship in SCPH, International Center for Homeopathic Medicine, United States. He has presented papers in homeopathic approach for the treatment in different type of cases, especially psoriasis, thyroid problem, PCOS, epilepsy, hypertension, respiratory disorders, parahemophilia, GERD, alopecia, infertility, etc. He has presented in Doordarshan and various other TV channels. He has written articles in various papers also. He has presented some of the best papers in our forum, and we, as you all know, that today he will be presenting on STAPHYSAGRIA, garden aristocrat. That's something great. So let us proudly welcome the master of the day, Dr. N. GURUKIRAN. Welcome, doctor. You can commence your presentation now.
Please unmute, Dr. GURUKIRAN. Please unmute.
What happened?
Yes. Now I'm able to hear.
Yes.
Yeah, fine. Okay. Thank you, sir. Thank you for the welcome. Good evening and good morning to some part of the world. Yes, for the today's session, I have selected a topic on STAPHYSAGRIA. As we all know, as homeopaths, we use in our daily practice this drug STAPHYSAGRIA. So, what about this STAPHYSAGRIA? This is the flower of STAPHYSAGRIA. It's called as garden aristocrats. Why it is called as garden aristocrats? Let us discuss with all those things. Before that, tribute to the master, Dr. Samuel Hahnemann. And today's agenda for this session, what we going to learn or share the knowledge in a today's webinar is about the STAPHYSAGRIA's introduction, history of STAPHYSAGRIA, pathogenesis of STAPHYSAGRIA, timeline. How can we apply in our clinical practice in the today's perspective, and summary of the whole session. So this will be the agendas for the today's session. I have made an attempt on STAPHYSAGRIA this time. If I If I up to the mark about these agendas in the today's session, it will be done for the today's session. And if you got something from this, from the today's webinar about the STAPHYSAGRIA that you can apply in your clinical practice, my efforts will be fulfilled. So about introduction. As we know that the STAPHYSAGRIA persons are very dignified and very self-conscious. They are very sensitive to external impressions and they suffer a lot for themselves. This is the core picture of the STAPHYSAGRIA. So, what about STAPHYSAGRIA? Dr. Boger says. Dr. Boger says, the faculty of mastering a drug is not dependent on the encyclopedic memory, but rather upon the inquisitor's ability to pick out among essential embodiments of each picture the things which show how it exists, moves, and being nearest similar. It's a inquisitor's ability to pick. We have to pick from the patient's language that which is suitable for the remedy, and we have to match accordingly and we have to prescribe on it. History. This is very interesting. There are 2 to 3 stories for STAPHYSAGRIA. One of the stories says about this in the Greek mythology. It's a mythological story in the Greek. There were 2 fellows, Hyacinthus and Apollo, the sun god Apollo. So both of them were friends. And this lad, Hyacinthus, was playing a discus. We know the discus throw, a game. A discus was playing with sun god Apollo. So what happened was, due to the jealousy, Zephyrus, a wind of God wind, he blew in the air forcefully to the discus when they are playing. The discus went rapidly and cut the head of Hyacinthus. He fell down and he was in the blood. By seeing this, the god Apollo had grief on seeing this, his best friend Hyacinthus' death. So the blood shed which has been from the Hyacinthus has turned into this flower, STAPHYSAGRIA. This is one of the mythological stories. And another story tells us about these 3 fellows, Ajax, Odysseus, and Achilles. Some of them might seen the series, seen the movie of Troy, an English movie. It's a very beautiful movie, Troy. If anybody has not watched it, please go and watch Troy. It's about the story of very 2 small islands, about the Greeks and Troy. From that, Achilles, a hero, a warrior. You can go and watch it. So, in the mythological story also, these comes. He is called as Ajax. Okay, and he is Odysseus. What happened was, he was a hero, another hero for the Greeks, Ajax, and son of Telamon, and a famous hero of Trojan War. He was having some fight with this fellow Odysseus, where he wanted to take an armor, means self-respect in the army. So in these kind of things, once what happened was, Odysseus was awarded the armor. So Ajax decided to kill by the Greek leaders to take a revenge. But Athena, the goddess of wisdom, temporarily caused temporarily insane, and instead of killing Ajax, the Athena, goddess of wisdom, slaughtered the horned cattle and the splendid goats. So this made Ajax was disrespect. So what he did was he fell on his own sword and he suicided. From him, the blood came out. He is Achilles. So what he did was, at this time, the hyacinthus, what I told in the previous story, the hyacinthus sprang up, and the blood which came out from the Ajax was made into this flower, that is STAPHYSAGRIA flower. He made 5 petals out of it. See, if you observe the STAPHYSAGRIA flower, it has got 5 petals. So from the blood of Ajax, this hyacinthus had made 5 petals, which turned blue. So this is 2 mythological stories. Both the stories speak about passionate love and passionate inconsolable grief. 2 things are there in the mythological stories. And also, this story brings out homosexual leanings. From the previous story, the Apollo and the hyacinthus. So these are the things where can we get in STAPHYSAGRIA lives, in the STAPHYSAGRIA patients in our clinics, when they speak about themselves. They also speak about jealousy and possessiveness. This comes under STAPHYSAGRIA type picture. Why I am telling these stories are, these are the characteristics which comes in STAPHYSAGRIA mind. The STAPHYSAGRIA characteristics, the patients. So this story becomes very, very important. The 2 mythological stories. What is this? Dragon. Another story is there about this, is an Italian legend tells about this. 3 warriors once killed a dragon and they cleaned their swords in the plain grass. After killing the dragon, they cleaned their swords on the grass. This turned into larkspur. Larkspur is the common name of STAPHYSAGRIA. When they clean their sword on the grass, it turns into larkspur. The blue dragon's blood, what they have killed, the blue dragon's blood gave its color blue, and it became poisonous because of the blood, dragon's blood. So these are the various stories when we search for the history of STAPHYSAGRIA. These are the main 3 stories what I have told you today. Is the 3 main stories of how it formed, STAPHYSAGRIA. So STAPHYSAGRIA plant. STAPHYSAGRIA is an elegant plant usually found on the fence of a garden. It's commonly called as larkspurs or stavesacre. The larkspurs are ornamental biennial herbs. It's been cultivated since the time of pharaohs for their medicinal properties. This STAPHYSAGRIA plant belongs to Ranunculaceae family. Appearance. How it appears when you see the plant. This is the photograph of the STAPHYSAGRIA plant. The whole plant with the flowers. This is the zoom photo of flower. See the 5 petals with the fur. That is why it's called as larkspur. You can see the fur. And this STAPHYSAGRIA plant grow to a height of 2 to 2.5 feet or 3 feet tall. The stem is hollow and erect and needs support against the wind. The shape of the bud resembles that of a dolphin. Hence it is called as delphinium. The common name also is called as delphinium. Flowers have got 5 petals with a spur at the end, hence called as larkspur. Habitat, where it grows. It is native to the northern temperate regions and mountains of East Africa, also found in Italy, Greece, Asia, and Mediterranean. Doctrine of signature. This is very, very important to us. This STAPHYSAGRIA, the majestic beauty of the plant, is found in the patients also. As I said, the persons are elegant in nature, haughty in nature, with sensitivity, too dignified to show their feelings, thereby suffering from reserved displeasure. So these are the characteristics when you see a STAPHYSAGRIA patient. They'll be too dignified to show their feelings. They will not open up. I think in the first sitting, they may open up in the consecutive second, third, fourth sittings, thereby suffering from the reserved displeasure. They're too reserved. The patients will be too reserved. They're elegant, haughty in nature, and oversensitive. If somebody says something, they are very sensitive to external impressions. So this can we find out in the STAPHYSAGRIA patients. This is the doctrine of signature. Pathogenesis. What does it contain? STAPHYSAGRIA. There are two alkaloids, delphinine and staphysagrin, which substantiate the pathogenesis of the remedy. When somebody asks, what does it contain? STAPHYSAGRIA, you can say definitely it contains delphinine and staphysagrin. These are the two alkaloids. What does it do? It has pronounced effect on the nervous system, eyes, skin, teeth, male and female genitalia, respiratory and urinary systems. And also, STAPHYSAGRIA has pronounced effect on the nervous system with great sensitiveness to the least impression, either mental or physical. This is what we find in our materia medica. Herring says, morbidly sensitive, the least word seems wrong, hurts very much, special senses become irritable, cannot tolerate touch, odor, noise, and taste. Everything is painfully sensitive. So these are the things. Clark says. What does Clark says? This is very, very important. You can find it in the Clark's. STAPHYSAGRIA produces long-lasting vertigo accompanied by continued nausea, as in seasickness, vertigo, which ceases on rapidly turning round on one's heel. It's a very characteristic symptom. Clark writes, vertigo which ceases on rapidly turning round on one's heel. This is the marked symptom in STAPHYSAGRIA. If any case comes out with these kind of symptoms, you can blindly prescribe STAPHYSAGRIA. Modalities, which is very, very important. Ailment from anger suppressed, honor wounded, embarrassment, mortification, surgical procedures. Worse from mental affections, chagrin, quarrels, loss of fluids, excess tobacco, sexual excess, night aggravations, new moon aggravations, and before full moon aggravations. So these are the things. These are very, very important points. And amelioration from warmth, rest, breakfast, caution. So these are the modalities. If you want, once again, you can take a picture of it. These are very, very important modalities of STAPHYSAGRIA. What is the collective totality of STAPHYSAGRIA? Ailments from, which is very, very important in each and every case. when you think about STAPHYSAGRIA. Aggravation, ameliorations, as I said, but the modalities, sensations and complaints in general. This is also very, very important. Mental state. This is according to the each individual case. If you go on study STAPHYSAGRIA in detail, then we are able to see these kind of things. Miasms. As we all know, SORA, psychosis, syphilis. So we can differentiate according to the miasms, the symptoms. This is a very broad attempt. There are a lot of things to add to SORA, psychosis, syphilis. Broadly, I have added these things. It purely depends on the case history. According to the case, you can differentiate the symptoms, psychosis and syphilis. Depends on the individual case. This is just a broad attempt. Soric, according to the Soric, ailment from the stress, anxiety, fright, aggravation from stress, hunger, motion, amelioration from music. And hypersensitive cases, indignation. So what are all psychotic symptoms? Suppressed anger, grief, mortification, suppressed anger, confusion, disappointment, sty, calasion. So these are all the psychotic symptoms. What are the syphilitic symptoms? Somebody killing him, caries of the tooth, rectal bleeding, urethra with pus, urethral affections with the pus discharge. These are all the differentiation symptoms of according to the miasms. SORA, psychosis, syphilis. These are also very, very important. Where you can enter a case when there is a lot of trouble in the case, when there is a paucity in the case. So let's move on to the cases now. What is this? Can anybody type it in the chat box? What can be the diagnosis? Any differential diagnosis for this? Yes, right. Dr. Rasina Mohammed says calasion, right? It's calasion. So, an young female, aged 18 years, was presented with the swelling over the right upper lid since 2 months. She presented as a sty. The patient don't know. She presented as a sty. After examination, it was diagnosed as calasion. She was having very mild irritation. So once we got to know the diagnosis, directly I go to the repertory. In the special repertory, there is a rubric calasion, which indicates the remedy STAPHYSAGRIA. Single remedy rubric. So according to the repertory, the prescription is STAPHYSAGRIA 200 single dose for 15 days. I have given 3 to 4 doses in this case. STAPHYSAGRIA has disappeared. After giving STAPHYSAGRIA, calasion disappeared. Next, move on to the second case. A female aged around 50 years was presented with the hypothyroidism, having symptoms of weakness, burning sensation of the legs, giddiness sometimes. This is her thyroid profile. T3 is 1.36, T4 is 5.72, TSH is 8.29. . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . So after case taking, the mind of the patient is very irritable, easily angered, quarrelsome. The patient has suppressed anger due to financial worries. The patient at present also she has got some irritable nature. So, what are all the rubrics from this case? Ailment from anger suppressed and financial worries. So, if we repertorize this, we get ailments from suppressed emotions, especially anger, and financial worries. The remedy which comes out is STAPHYSAGRIA. STAPHYSAGRIA 200 single dose. And also I have given I think 3 doses, monthly 1 dose. After 3 months, our test come down. It was 8 point something. T3 2.04, T4 7.15, T6 is 5.7. The patient is under treatment still. This was a recent case.
The slides
the
are
last
not clear. Dr. Gurukiran, slides are not clear. What happened?
I don't know. So it's raining here. I think there is some trouble with the connection, I think.
Okay, okay, yes.
Shall I go backward?
No. Please proceed.
Okay, right. It's raining heavily. I think there is internet connectivity problem, I think. Is this slide clear, sir?
No, looks like blood.
Okay.
Blood vision.
1 second. This one, sir? STAPHYSAGRIA?
Not clear.
Oh.
Make it more sharper. Sometimes it appears good. Sometimes it is.
Okay. I think due to internet connectivity, I think.
Maybe.
Okay. Shall I move on?
Oh, yes. No doubt. Please
Okay.
proceed.
So, it has reduced. The TSH level has come down. Now, third case, a female aged around 26 years was presented with the burning in the urethral region since 3 to 4 days. The burning was so severe that patient cannot even sit or pass urine. The patient was newly married just 10 days back. So, what can be the diagnosis? According to the case, the rubrics are urethra, burning pain, cystitis, newly married. This is called as honeymoon cystitis. So, what is the standout remedy for honeymoon cystitis? STAPHYSAGRIA. The repertory: urethra, pain, burning, cystitis, women in newly married. There is a specific rubric which shows STAPHYSAGRIA. So, after repertorizing, I have prescribed STAPHYSAGRIA 200 single dose. Patient got very much better. So, wherever in our clinics we get a case of honeymoon cystitis, we should not miss out. Definitely, you should think of STAPHYSAGRIA. If there is associated symptoms with urethra. Let's move on to the case 4. It's a case of pseudoarthritis. A female aged around 45 years, a known case of pseudoarthritis, presented with the symptoms of joint pain, since 3 years, the patient had been to rheumatologist with no much relief. All the investigations were normal in this case. So the patient presented with the symptoms of pain in the joints with weakness. The patient explains about the weakness of the joints with the pain. He clearly explains it. There is a joint pain and she feels weak. She feels weak. The joint feels weak. So it's a characteristic entry point to the case. There is a rubric in the Murphy repertory. It shows pain, joints, weak, feeling in. This is the rubric I have entered. Pain, joints, weak, feeling in. See this in the repertory. A single remedy rubric which shows STAPHYSAGRIA. Pain, joints, weak, feeling in. So definitely I have prescribed STAPHYSAGRIA 200 single dose, and I have repeated a few doses more in 15 days time. The patient got relief very much and she is happy. The pain has reduced and the weakness has gone in the joints. That's very, very important. That was the thing she used to tell. So there is a pain associated with weakness in the joints. If that is the case, think of STAPHYSAGRIA. So case 5. It's a case of fever. A male is about 43 years, was presented with acute fever since one day. The fever was high, very much high it was. Thirstlessness, fever during. The patient was thirstless. And the patient was chilly. So, when the patient say fever, so as being a homeopath, we should enlarge or we should poke much more to the case. And I asked him, what are the associated symptoms or any other modalities? The patient presented with the strange symptom of appetite, hunger is increased since one day when he started with the fever. So much that he clearly said in front of me that if you give 1 kg of rice now, I'm able to eat in the fever. So usually what happens? The physical generals drops. It becomes, there will be loss of appetite, loss of hunger, all those things. But in this case, a strange symptom, the appetite and hunger is increased, especially during the fever. The patient was clearly telling that if you give 1 kg of rice, I'm going to eat it now. That much hunger I have got. So hunger increased during fever. Is it not a strange symptom? Is it not a characteristic symptom to enter a fever case? Yes, definitely. So rubrics taken were appetite, increased fever during, thirstlessness, fever during. And he was not having any thirst. He was thirstlessness. So there is a rubric in the complete repertory, which you can see in the repertory chart. Appetite, increased hunger, fever during. Thirstlessness, fever during. So what is the remedy which is standing out? STAPHYSAGRIA. So definitely the prescription will be STAPHYSAGRIA. So in this case, I have given STAPHYSAGRIA 1 ml because the characteristic entry point, the case is clear, which is showing STAPHYSAGRIA. So 1 ml, single dose. By morning, the patient is better. He has gone to his job. The patient was a teacher, so he went to the school in the morning. That's all. The 1 single dose and then the magic. So this is the powerful approach towards the acute cases. Hunt for the PQRS symptoms. Hunt for the characteristic symptom. Enter through it. If you have any doubt, please repertorize it. Make a totality, acute totality. Prescribe on it. So let's move on to the sixth case. A male aged around 50 years was presented with the knee joint pain since 8 years. The patient had been to other doctors without any kind of improvement. So at this age, what we can expect is osteoarthritis. So after case taking, detailed case taking, the mind of the patient shows is an extroverted in nature. Especially he has got some financial worries because he is a businessman. Definitely has got some financial worries and honor wounded. Again, he told me one important rubric: self-torture. Means he used to torture himself with some kind due to these kind of worries, financial worries and honor woundedness. He used to torture himself, self-torture. So these are all the things we have to be open when the patient sits in front of us, and we should be open to this kind of symptoms. So rubrics made were self-torture, financial worries, honor wounded, pain knees. So let us see in the repertory chart. What does it comes? See all those things: mind, self-torture, financial matters, worries, financial worries, honor wounded, pain knees. So the indicated remedy which comes out is STAPHYSAGRIA. This is another picture of STAPHYSAGRIA. I have collected different pictures of STAPHYSAGRIA so that I can show you how the plant looks like, the monographs. So STAPHYSAGRIA 200, 2 doses were given. After a month after prescribing STAPHYSAGRIA, the patient improved very well. The knee pain has reduced. The self-torture, what he has said, it has drastically reduced. There were no self-torture at all. And all those things were improved. And the financial worries were still there due to this business things. But the knee pain has drastically reduced. And there were no self-torture from the patient side. So this is how the drastic changes that can happen when you prescribe the right remedy. The patient is very happy. For the today's session, this would be the last case. A female aged around 34 years was known case of hypothyroid since 5 years, was under thyronorm. So this was the report of the patient. T3 is 1.19, T4 5.21, TSH is 53.7. This was pretty much high. So after detailed case taking, for the today's session, I have taken it very gist of it, only summaries of the case. The patient is introverted in nature, having weeping tendency, oversensitive to rudeness, ailment from suppressed emotions. So all these things, what we can find it in the doctrine of signature, in the picture of STAPHYSAGRIA, this we can find it in the patient. So the rubrics were ailments from suppressed emotions, mind oversensitive, according to it, see, ailments from suppressed emotions, and the patient is oversensitive. The indicated remedy which comes out is STAPHYSAGRIA. So the prescription were, this is a long case. It has taken, I think, 1 year. I'm sure I will show the reports. I have prescribed STAPHYSAGRIA 200, the starting in the initial phase, then I have shifted to 1M and have shifted to 10M. I think also I have given 50M one single dose. Recently, I think on 4 or 5 months back, I have given it. So all the potencies were used, but the remedy is STAPHYSAGRIA.
Doctor, please elaborate the case a little more. This
This case, sir.
Yes.
Okay, I'll tell it, sir. I'll show the reports and I'll tell it. So see the report. It's absolutely normal. T3 is 1.5, T4 is 96.4, TSH is 2.1. So in this case, the patient were oversensitive, especially to rudeness. This what I have found out in the patient. And as I said, the mind, and also there is suppressed emotions. Patient is oversensitive. See, these are the key characteristics of the mental picture, what I have got in this case. Patients were introverted in nature, especially when there is any fight or any rude behavior from her husband or any of the family members. She would cry. That much she was oversensitive, and there were a lot of suppressed emotions where she could not express herself in front of her husband also, somebody is also. There are a lot of suppressed emotions. So these are the ailment from. As I said in the modalities section initially, this plays a very important part. Ailment from. So if you find a case, ailment from suppressed emotions or ailment from anger suppressed, definitely you can think of STAPHYSAGRIA. So these are all the things. Then I have mediated totality and have the chart. So the indicated remedy comes out is STAPHYSAGRIA. So according to that, because the mental picture is dominant in this case, initially I have given STAPHYSAGRIA 200, then 1M, then 10M, then 50M also. See the report, you can see yourself. TSH is absolutely normal. So summary from the today's session. So you should not forget the STAPHYSAGRIA. STAPHYSAGRIA as a remedy is being known more for its reaction to mortification and suppression, especially emotional suppressions. Tendency to suppress emotions. This has got marked in STAPHYSAGRIA. An effort to bring out the evolutionary picture of STAPHYSAGRIA with its clinico-pathological and mathematic correlations in integrated way. This was a small effort from my side that I have correlated all those things, clinico-pathological and mathematic things in an integrated way. So thank you one and all for this wonderful session. If there is any queries about STAPHYSAGRIA, so that I can answer your queries.
Definitely, it's a wonderful presentation. As we never thought that such 7 cases of this STAPHYSAGRIA will be presented in a short time like this, just like firing bullets. And with the time for discussion, I invite Dr. Manoj to begin the session.
Thank you, Dr. Dhanesh. Definitely not out of his potential. He's always very fast. Simple rubrics reaching the remedy. That's the most important thing. Just to mention about the inquisitive ability. As you write in the beginning, you mentioned about the Boger's reference, the inquisitive ability to pick up the right symptom. That's the most important thing. Then I mentioned about 7 cases. The one is thalassian case, that is definitely STAPHYSAGRIA case, then hyperthyroidism. Then another one is the honeymoon cystitis, that's also strongly indicates STAPHYSAGRIA. Then the pseudoarthritis case, fever case. The very interesting one because nobody will in a hurry to reach such symptoms. Who will inquire about the appetite? I have a case, a similar case a couple of years back. where the child was accompanied by his neighbor pediatrician and saw that the mercury reaching the maximum thermometer, but got this symptom, the appetite increased during fever, and got the medicine relieved the patient very effectively. So that is the most important thing. The classical homeopathy is there. It should be adopted. That's the most important thing. Then you mentioned the hyperthyroidism cases. Then I think one medicine is very similar to this STAPHYSAGRIA, that is colchicum. The words or misdeeds of others affect him. Did you notice that, Gurukiran?
Yes, sir.
Very similar. It is very similar to this colchicum. Beg your pardon, the STAPHYSAGRIA is colchicum. Anyway, nice presentation. We are expecting more from you. Congratulations, Dr. Gurukiran. Thank you.
Thank you, sir.
Yes, Dr. Manoj had a little more to the STAPHYSAGRIA case, and if at all anybody want to have a chat or want to have a question, or if you want to know about this, any of these cases a little more, you can ask the. You can raise your hand or you can write down here so that he will be able to explain about the case. Really, as a homeopath, we are very proud. You are a person supposed to get PhD directly, even without any examination or going through so much of a 5-year period. Because that kind of effort you are taking in curing the case, not as per Kent, it is written that a person who really a person who practices homeopathy for the love of homeopathy is the person who is the winner. And so this is what you are doing every day. And all the presentations here are really what, according to the Ken, is a person who done so much of good for homeopathy. That's what I have to, I would like to add to your presentation. Dr. Manoj, you can elaborate a little more on that.
Definitely, we must think from the other side. How we are getting such symptoms from patient. How the material medical is composed. So during proving, when the patient is taken this medicine, definitely such surroundings will aggravate his complaints, the symptoms. That will produce more symptoms. Thus, we reach as a conclusion that STAPHYSAGRIA, the aggravated ailments from such and such conditions. That is the reason. Otherwise, there is no other option. So method to study how from vexation, mortification, how it is happens. The Hahnemannian art, he always observes after prescribing this medicine, and the patient got some sort of aggravation or some disturbance from his the surroundings, just like this vexation or displeasure, reserved displeasure, all these was complaints. That is the reason for that. That is why these symptoms are adopted in the materia medica. And we can see that there are a lot of medicines or the so-called after this randomized control trials often fails while we prescribe in patients. But none of our medicines failed, even after 200 years. What is the difference between these two? These are the true observations based upon actual truth. The other thing are only for industry, for the sake of industry. Homeopathy is not like that. That's why anyone says the greatest gift of God is homeopathy. That's why he said. Okay.
Yes, exactly. That's what all about. Dr. Manoj had to add. Definitely. Even in the last case, you can see that only two rubric, particularly the oversensitiveness. Usually, why some people are not getting the exact result what Dr. Gurukiran can get from single remedy, because in those cases, if the patient used to cry whenever they used to scold, or whenever she used to be a sort have a discussion with someone talk loudly or something like that, whatever maybe she used to like. What happened is that as a junior doctor, sometimes you may take the rubric weeping, consolation, aggravation like that. When a consolation, always weeping. That may be the rubric taken, but here it is he has not taken the rubric weeping at all. That is what I have noted. So oversensitiveness and weeping are entirely different. A lot of symptoms are collected together and put the rubric oversensitiveness for that. Am I right, Dr. Gurukiran?
Yes, sir. Definitely, sir. That's why I have told the three stories where the sun god Apollo and the hyacinthus. There comes again the homosexuality. There is some homosexuality living in that story, in the mythological story. So these are the three stories that depicts the picture. That's why I took it up in the initially about these three mythological stories, where it comes all those things: oversensitiveness, courage, armor, the self-respect, disrespect, haughtiness, homosexuality, all these things, all these rubrics, which comes in these three mythological stories.
Yes, another interesting point is that through four sentences, he concluded the totality, how it becomes. The most interesting, the ailment sum, the mental state, the aggravation, amelioration, the sensations. With all these four components, we can complete the total. That's quite interesting one. Then you mentioned about this, the miasmatic cleavage or different symptoms. What are the miasms behind that? Then as Dr. Dhanesh mentioned, Dr. Gurukiran often becomes successful. Why? As advised by Hanuman, he is often this not at all prejudiced. The doses are too small. Then waiting, that's another thing. How he is able to wait? Because he is confident of his prescription. Why he become confident? Because he has got the ability to pick the right symptoms. The most important, the character symptoms. So we need a thorough study of the philosophy of homeopathy. Without proper studying the philosophy of homeopathy, the material medica, we cannot assimilate, we cannot digest. Each and every medicine looks very similar. There is no difference. We cannot differentiate between belladonna and bryonia without studying this homeopathic philosophy, especially the chapter of the symptomatology on tuberculosis. If you go thoroughly through the genius of homeopathy, that chapter, symptomatology, definitely you can absorb more the homeopathic material medica in its real form, in the real taste, in the real flavor. Am I right, Dr. Gurukiran?
Yes, sir.
Somebody should participate in discussion.
Sir?
It is quite, you cannot justify it. Because after listening for 45-50 minutes, you don't have such comments. You are not listening, maybe.
Simply writing excellent presentation is not the good way. You just come out from the curtain, behind the curtain, come up openly and ask your question. Or you can even you can ask Dr. Gurukiran to explain a case you might have missed here because he was simply explaining in a short way. That is, in a nutshell, we must say. So, if you want to hear about a particular case, you can ask for more. Definitely, this is what we are doing. Unfortunately, such brilliant cases were not getting what kind of appreciation it should get.
Yes, that is the most important thing. That especially that fever case itself, it producing. You said about this, the common symptoms or the physical generals. It surpass all these things. The patient is feeling very hungry. So it's our ability to believe in that. Dr. S. Ram Pravesa?
Yes.
Yes, please.
Thank you, Dr. Manoj ji, and congratulations, Dr. Gurukiran ji.
Thank you, sir.
Very nice presentation. STAPHYSAGRIA case. Anger and anxiety. Very nice presentation. Very, very thanks. STAPHYSAGRIA is a very good remedy. Our case presentation is a beautiful describe and single remedy as STAPHYSAGRIA. Thank you, sir. Thank you.
Thank you. Thank you very much.
Doctor, what's your opinion about the potency selection? Usually, some people used to give the 0 bar 3 LM potencies regularly. Some people particularly Dr. Nigam, I used to give only 30th potency a single dose, and he wait even with that same case, he get the result. He has shown
Yes, sir.
in almost
There is lot of ambiguity in those things, sir, because as our principle says, as Stuart Close says, not only 30 potency can cure all cases, or not only higher potencies can cure all the cases. Any potencies may be required in the given case. So we should be ready with all the potencies. What I personally have an experience with it. I also use 30 potency, also use 12, also use 50M, also use CM. Depends on the case. When there's a clear-cut case picture, where there is a characteristic entry point is there, where mind is very much strong, I would like to prescribe on the higher side. Maybe more than 1M, 10M, 50M. If there is a pathological symptoms, the pathology is more in the case, then I would like to prescribe in the lower potencies. All the things are there. That's why we have got the scale of potencies. When it comes to LM scale of potency also, there are a lot of things.
Dr. Gurukiran, still a lot of components has to be added, because just in the acconate, when the patient is healthy, very strong, when the cause is very strong and the symptoms are very violent, then only acconate indicates. So
Yes,
it's a very complicated thing, not an easy affair to become a good homeopathy physician.
Yes.
Trying to wind up, Dr. Sanesh, yes, please. You're muted, doctor.
invite Dr. Manoj to say what are thanks to this session also.
Thank you. Anyway, these types of young talented physicians are really a gift of homeopathy, and they will keep the homeopathy. They will just to reach like Chandrayaan, keep in more and more height. Definitely with single medicines and simple medicines with a clear view of homeopathy philosophy. Moreover, they are more studying. That's the most important thing. In different repertories, different textbooks, has got a very well versed or well aware of the situation, as said by Henneman. It's nice presentation on behalf of IFPH. I am expressing sincere thanks to Dr. Gurukiran and all those participated in the session. Thank you.
Thank you, Dr. Manoj. And tomorrow we will have a session from Dr. Sadat Said, and he will be presenting management of ulcers with homeopathy. Dr. Gurukiran, you want to say anything more?
Thank you for this platform again. For my exposure in this platform is very good for me till now, and I would like to continue. Yes, thank you for this opportunity. Thank you one and all in the IFPH platform. Thank you, sir.
Definitely, we require more presentation from you, because this is kind of classic presentations will definitely take homeopathy to a higher level, and more people will watch this business, because we are uploading it in the very next day itself nowadays, so that those who have no knowledge about homeopathy will watch what is happening with homeopathy, and definitely that is what homeopathy is being promoted here. Thank you all for the session. A wonderful session. Hope tomorrow at the same time we can meet again. Thank you. Good night. It's
Thank you,
over.
sir.